Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 pandemic update for data through May 20th, 2021. Last week, I posed a couple of questions, and because of the glitchy nature of the internet, I'm going to repose those questions today and update them as well. So how's the pandemic progressing globally in the U.S. and in our region? What did the CDC just say about people who've been fully vaccinated, and why is this confusing for some people? And wouldn't it be safer if I skipped the vaccine and just waited until the country gets to herd immunity? That's a question that came in from one of my professional colleagues. So how's the pandemic progressing globally in the U.S. and in our region? Worldwide, over 3,400,000 deaths have been documented, a 2.4% increase in the past week. And that's actually the lowest percent increase we've had in a couple of months. But you can see this sort of undulating pattern. It looks like it's progressing downward, which is good. But even still, last week, over 80,000 deaths worldwide. That's 8 deaths every minute. And for those of you that think that pandemic is coming to an end, it isn't. It is still burning out of control in many parts of the world. Early on, the pandemic hit China, and then in the spring of last year, it was largely in Europe. Then over the summer, it was in the Americas, including but not limited to the United States. Then in the winter and fall, we saw this real surge in deaths in both the Americas and in Europe. And while the pandemic continues to be a problem in the Americas, it seems to be coming down in Europe, but now increasing in South Asia, India, and related countries. Again, if you look at the number of daily deaths, it has come down from the peak of a couple of weeks ago, but it's still well above where it's been for much of the pandemic. This is still a serious global pandemic. The daily death rate is still a significant problem. If you look at those countries that have had more than 1,500 deaths per million, there are 20 of them. The U.S. is in 12th place. In the U.S., we've had one death for about every 550 people. So a considerable problem. In the U.S., so far, we've had over 600,000 deaths. And last week was a 0.6% increase on the number of deaths over the previous week. That is the lowest number we've had. We're glad to see it. You do see the same undulating pattern that you see globally, but we're a little bit lower than the global growth rate. So that's a good thing. And hopefully it'll continue to come down. We'll keep our fingers crossed. But even for this, there were over 3,700 deaths last week. That's 530 deaths a day. This is still a serious pandemic, and we shouldn't be overly optimistic that it's coming to an end just yet. In terms of the daily number of deaths, you can see again this undulating pattern where we had a spike in March of last year, then we had a big spike in December and January for the early February of this year, and then it's been coming down. But one of the things that worries me, continues to worry me, is it's not coming down to zero. You can see that we're still having 500 plus deaths a day, and that's pretty much where it was for much of the summer. So again, we're keeping an eye on it. Hopefully it's slowing down, but it hasn't come down to zero just yet. In our region, in the Ballot Health Service area, 2,065 deaths, about a 1% increase in the past week, 19 deaths last week, 2.5 deaths every day. Again, still a problem, though not nearly the problem that it has been in the past. In terms of hospitalizations, we were worried about this resurgence, it looked like in the last month or so, but fortunately the number has come down. I believe the number is 70, which is about the lowest it has been since August of last year. But again, still a pandemic, still burning out of control in many parts of the world. And as we said before, if it's burning out of control anywhere, every time it spreads, every time it grows in somebody, there's going to be mutations, there's going to be variations. And as the virus mutates and changes, there is the possibility that a virus will develop that is able to escape our immune system, and we will see a resurgence of that particular variant. So we have to keep an eye on that. So last week, the CDC came out with new guidance about people who've been fully vaccinated. And the guidance is actually pretty straightforward, and it's well based on science. And it says, basically, if you've been fully vaccinated, you can resume activities that you did prior to the pandemic without wearing a mask or staying 6 feet apart, except where required by local regulations or local businesses. There are a few exceptions like public transportation, nursing homes, and so on, and certainly some caution about international travel. So, and then they also say if you get symptoms, you still need to be tested, even if you've been vaccinated. So why is this confusing for people? Well, unfortunately, many people have interpreted this to say that the pandemic is over. The key phrase here is fully vaccinated, right? This only applies to people who are 2 weeks out from the 2 shots of Pfizer or Moderna, the 1 shot of J&J. All right. No one else, just people who've been fully vaccinated. Unfortunately, people are acting as if this is saying that everyone can return to normal. The problem right now is, as of a couple of days ago, only just over 1/3 of Americans are fully vaccinated. That means 60%, almost 2/3 of Americans have not been vaccinated. All right. So what I think people found confusing about this is prior to this, the advice coming out from the CDC was for everyone. Now, this particular piece of advice is for those who've been fully vaccinated. Right? If you have not been vaccinated, all the previous advice still applies. You need to wear a mask, you need to social distance, you need to avoid crowds, and you need to get vaccinated. Now, remember, even people who've been vaccinated have to pay attention, because if they get symptoms, they need to be tested. And the reason for that is there's a very small chance that if you've been vaccinated, you could still get COVID-19. An even smaller chance that it will be serious. But again, as I said before, there may be new variants. And as long as the virus continues to spread worldwide, there will inevitably be new variants. So yes, the guidance relates to people who've been fully vaccinated, not to everyone else. For everyone who hasn't been vaccinated, you either need to get vaccinated or you need to continue to wear masks and socially distance. Now, some people have said, well, wouldn't it be safer if I just skipped the vaccine and waited until the country gets to herd immunity? This question came in from a professional colleague, so I want to address it in a little bit of depth. You remember, we've talked about herd immunity before, but let's walk through it again. Say you have 100 people, all of whom are susceptible, none are immune. They could all get the disease. And then the disease arrives, and it affects a number of people. They infect others, and they infect others, until most people who are going to get infected are infected. In some cases, almost everyone will get infected. In some cases, not. In the case of COVID, it looks pretty widespread. Right? Now, say you take 100 people again, all of whom are susceptible, and you vaccinate 75% of them. Now, the vaccinated folks, the immune folks, the folks that are protected, are yellow dots. The disease strikes. There's some initial infections, but very little secondary spread. Most of those who are not immune are protected, and that's what we call herd immunity. They're protected by the herd. All right. Now, some have said, well, why don't I just wait until there's 75 or 80 or 85% or whatever it happens to be herd immunity? Here's the problem. Let's take the same 100 people and we vaccinate 75% of them. But now you see there's a cluster down in that bottom corner of folks who have not been immunized. This is analogous to the mothers on the West Coast who aren't vaccinating their kids against measles, and analogous to some folks on the East Coast who, for whatever reason, are not immunized against COVID-19. Right? Now the disease arrives, you have your few number of initial infections, but it can continue to spread. So here's the point. Herd immunity happens when everybody across the society is equally protected. All right. If there's a cluster of people who, for political, geographic, or socioeconomic reasons, are not getting vaccinated, they are still at risk, and we can still see spread. And as spread happens, variants happen. As variants happen, we're going to see a prolonged pandemic. So no, you can't wait for society to get herd immunity to protect you. You need to get vaccinated. So the pandemic is still burning pretty hot globally, slowing down in the US and in our region. We'll keep our fingers crossed on that. The CDC says if you're fully vaccinated, you can return to normal with some exceptions. It doesn't apply to people who haven't been vaccinated. And if you wait for everyone else to get vaccinated, you're part of the problem. A great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. I'd like to thank Dara Young for editing, producing, and posting this video. And as always, your questions are what guide what I cover each week. Thank you for that. Look forward to seeing you again next week. Until then, please be well. Thank you.